Assalamu alaikum. Today we will discuss renal stones. We will speak about terminology of renal stones, risk factors of renal stones, causes of renal stones, clinical pictures, investigation, treatment, and prognosis of patient with renal stones. I hope you enjoy these lectures. Thank you very much. Now we will speak.
The kidney stone is a hard, crystalline mineral material formed within the kidney or urinary tract. 1. Kidney stones are sometimes called renal calculi. 2. The condition of having kidney stones is termed nephrolithiasis. 3. Having stones at any location in the urinary tract is referred to as urolithiasis. 4. The term ureterolithiasis is used to refer to stones located in the ureters. Risk factors for kidney stones. 1. Urinary tract stones are more common in men than in women. 2. Most urinary stones develop in people 20 to 49 years of age. 3. People who have already had more than one kidney stone are prone to developing further stones. 4. In residents of industrialized countries, kidney stones are more common than stones in the bladder. The opposite is true for residents of developing areas of the world, where bladder stones are the most common. This difference is believed to be related to dietary factors. 5. A family history of kidney stones is also a risk factor for developing kidney stones. Kidney stones are more common in Asians and Caucasians than in Native Americans, Africans, or African Americans. 6. Uric acid kidney stones are more common in people with chronically elevated uric acid levels in their blood, hyperuricemia. 9. A small number of pregnant women develop kidney stones. Factors that may contribute to stone formation during pregnancy include the slowing of the passage of urine due to increased progesterone levels, b. diminished fluid intake due to a decreasing bladder capacity from the enlarging uterus, c. mild increase in their urinary calcium excretion. However, it remains unclear whether the changes of pregnancy are directly responsible for kidney stone formation or if these women have another underlying factor that predisposes them to kidney stone formation. Causes of renal calculi. Kidney stones form when there is a decrease in urine volume and/or an excess of stone-forming substances in the urine. The most common type of kidney stone contains calcium in combination with either oxalate or phosphate. The majority of kidney stones are calcium stones. Other chemical compounds that can form stones in the urinary tract include uric acid, magnesium ammonium phosphate, and the amino acid cysteine. 1. Dehydration from reduced fluid intake or strenuous exercise without adequate fluid replacement increases the risk of kidney stones. 2. Obstruction to the flow of urine can also lead to stone formation. In this regard, climate may be a risk factor for kidney stone development, since residents of hot and dry areas are more likely to become dehydrated and susceptible to stone formation. 3. Infection in the urinary tract. These are known as struvite or infection stones. For metabolic abnormalities, including inherited disorders of metabolism, can alter the composition of the urine and increase an individual's risk of stone formation. 5. Medical conditions can lead to an increased risk for developing kidney stone. The gout results in chronically increased amount of uric acid in the blood and urine and can lead to the formation of uric acid kidney stones. The hypercalciuria, high calcium in the urine, another inherited condition, causes stones in more than half of cases. In this condition, too much calcium is absorbed from food and excreted into the urine, where it may form calcium phosphate or calcium oxalate kidney stones. C. Hyperparathyroidism. D. Renal tubular acidosis. E. Cystinuria and hypoxaluria. F. Diabetes and high blood pressure. Hypertension. G. Inflammatory bowel disease. H. Those who have undergone intestinal bypass or ostomy surgery are also at increased risk for kidney stone. Some medications also raise the risk of kidney stones. These medications include some diuretics, calcium-containing antacids, and the protease inhibitor inbanabur-crixavin, the drug used to treat HIV infection. J. Dietary factors and practices may increase the risk of stone formation in susceptible individuals. 1. Inadequate fluid intake. 2. High intake of animal protein, a high-salt diet, excessive sugar consumption. 3. Excessive vitamin D supplementation, and excessive intake of oxalate-containing foods such as spinach. 4. Low levels of dietary calcium intake may alter the calcium oxalate balance and result in the increased excretion of oxalate and a propensity to form oxalate stones. Clinical pictures of renal stone. 1. Kidney stones may not produce symptoms known as silent stones. 2. People who have kidney stones often report 1. Renal colic. The sudden onset of excruciating, cramping pain in their low back and/or side, groin, or abdomen. Changes in body position do not relieve this pain. The abdominal, groin, and/or back pain typically waxes and wanes in severity. Characteristic of colicky pain, it may be so severe that it is often accompanied by nausea and vomiting. 2. Bloody urine, hematuria. 3. If infection is present in the urinary tract along with the stones, there may be fever and chills. For sometimes, symptoms such as difficulty urinating, urinary urgency, penile pain, or testicular pain may occur due to kidney stones. How are kidney stones diagnosed? The diagnosis of kidney stones is suspected when a typical pattern of symptoms is noted and when other possible causes of the abdominal or flank pain are excluded. Which is the ideal test to diagnose kidney stones is controversial. 1. Blood tests. Blood tests may reveal too much calcium or uric acid in your blood. Blood test results help monitor the health of the kidneys and may lead a doctor to check for other medical conditions. 2. Urine tests. The 24-hour urine collection may show that there is excreting too many stone-forming minerals or too few stone-preventing substances. 3. Imaging tests are usually done to confirm the diagnosis. Many patients who go to the emergency room will have a non-contrast CT scan done. This can be done rapidly and will help rule out other causes for flank or abdominal pain. 4. Ultrasound in combination with plain abdominal X-rays have been shown to be effective in diagnosing kidney stones. In pregnant women or those who should avoid radiation exposure, an ultrasound examination may be done to help establish the diagnosis. Treatment. 1. Most kidney stones eventually pass through the urinary tract on their own within 48 hours, with ample fluid intake. 2. Ketorolac, an injectable anti-inflammatory drug, and narcotics may be used for pain control when over-the-counter pain control medications are not effective. Toradol, aspirin, and NSAIDs must be avoided if lithotripsy is to be done because of the increased risk of bleeding. Intravenous pain medications can be given when nausea and vomiting are present. 3. Although there are no proven home remedies to dissolve kidney stones, home treatment may be considered for patients who have a known history of kidney stones. Since most kidney stones, given time, will pass through the ureter to the bladder on their own, treatment is directed toward control of symptoms. Home care in this case includes the consumption of plenty of fluids. Acetaminophen Tylenol may be used as pain medication if there is no contraindication to its use. If further pain medication is needed, stronger narcotic pain medications may be recommended. There are several factors that influence the ability to pass a stone. 1. The size of the person. 2. Prior stone passage. 3. Prostate enlargement. 4. Pregnancy. 5. The size of the stone. A 4 mm stone has an 80% chance of passage while a 5 mm stone has a 20% chance. Stones larger than 9 mm to 10 mm rarely pass without specific treatment. For some medications have been used to increase the passage rates of kidney stones. These include calcium channel blockers such as nifedipine Adalat and alpha blockers such as Tamsulosin Flomax. These drugs may be prescribed to some people who have stones that do not rapidly pass through the urinary tract. 5. Lithotripsy. Extracorporeal shock wave lithotripsy SWL. Extracorporeal shock wave lithotripsy SWL. SWL uses sound waves to create strong vibrations, shock waves that break the stones into tiny pieces that can be passed in your urine. The procedure lasts about 45 to 60 minutes and can cause moderate pain, so give sedation or light anesthesia to make patient comfortable. SWL can cause blood in the urine, bruising on the back or abdomen, bleeding around the kidney and other adjacent organs, and discomfort as the stone fragments pass through the urinary tract. 6. Surgical techniques. A. Percutaneous nephrolithotomy involves surgically removing the kidney stone using small telescopes and instruments inserted through a small incision in the back. Under general anesthesia during the surgery and be in the hospital for 1 to 2 days while patient recovers. Doctor may recommend this surgery if SWL was unsuccessful or if stone is very large. B. Ureteroscope passed through ureter and bladder up into the ureter. To remove a smaller stone in ureter or kidney, Doctor may pass a thin lighted tube ureteroscope equipped with a camera through ureter and bladder to ureter. Once the stone is located, special tools can snare the stone or break it into pieces that will pass in the urine. Doctor may then place a small tube stent in the ureter to relieve swelling and promote healing. General or local anesthesia during this procedure may be needed. Prevention of renal stones. 1. Drink more water, since low fluid intake and dehydration are major risk factors for kidney stone formation. 2. Depending on the cause of the kidney stones and an individual's medical history, changes in the diet or medications are sometimes recommended to decrease the likelihood of developing further kidney stones. 3. If one has passed the stone, it can be particularly helpful to have it analyzed in a laboratory to determine the precise type of stone, so specific prevention measures can be considered. For people who have a tendency to form calcium oxalate, kidney stones may be advised to limit their consumption of foods high in oxalate, such as spinach, rhubarb, Swiss chard, beets, wheat germ, and peanuts. Also, drinking lemon juice or lemonade may be helpful in preventing kidney stones. What is the prognosis for kidney stones? Most kidney stones will pass on their own, and successful treatments have been developed to remove larger stones or stones that do not pass. People who have had a kidney stone remain at risk for future stones throughout their lives. Are home remedies effective for kidney stones? For some people who have had many kidney stones, home care may be appropriate. When passing the kidney stone, drinking lots of fluid is important. In fact, this is the most important home care measure. Medications may help control the pain as described previously. However, if it is the first time one has had symptoms suggestive of a kidney stone, it is important to see a doctor right away.
تكون انتهت محاضرة الرينال ستون. أتمنى أن هي تكون عجبتكم، أتمنى أن هي تكون زودت معلوماتكم. لا نسألكم إلا الدعاء. انشروا الفيديو. نسأل الله عز وجل أن يجعل شفاء الناس بأيدينا وأيديكم. السلام عليكم ورحمة الله وبركاته.